Death is inevitable, but what if it happened unexpectedly? You are on the top of your career, busy earning so much wealth. Something unknown to you strikes so hard that you have to stop everything. You were thinking while being confined within the four gloomy walls of the hospital room. It was only the floods where I walked through. The world is full of surprises. On this vlog, we will talk about the miseries brought about by this particular Earthling. Stay and watch till the end. The climate of the Philippines is tropical and maritime. It is characterized by relatively high temperature, high humidity and abundant rainfall. The rainfall is the N=, most important climatic element in the Philippines. According to PAG-ASA, the mean annual rainfall varies from 965 to 4,064 millimeters annually. The average is around 978 millimeters. Great portion of the rainfall, humidity and cloudiness are due to the influence by typhoons. And located along the typhoon belt, the Philippines is visited by an average of 20 typhoons annually, 5 of which are devastating. These devastating typhoons cause severe flooding in most parts of the Philippines. Aside from the destruction of property, these floods will take few days to subside, which made some residents has no choice but to wait. During these flooding, microscopic earthlings multiplies exponentially. The animals that are most affected are our pets. And other animals that lives on canals and garbage are affected too. One of the deadly earthling Cerebar prefers rats as their vector. In fact, they can live in rats' kidney tissues for more than 3 months without showing any illness to its host. A study was conducted by Jarlath E. Nally et al. The paper title posted below found in their observations that there is a unique biological equilibrium existing between the said microscopic deadly earthling and the reservoir hosts of infection, but surprisingly little is known concerning the host's cellular immune response that facilitates persistent renal colonization. These healthy carrier rats multiplies fast as well as their urine. And during this rainy seasons, their wastes and excretes will find its way to the streets, infesting the flood waters with these deadly earthlings. By now, you already have an idea who or what are these deadly earthlings are. Let's find out. Leptospira species is the microscopic earthling that causes Weil's disease or leptospirosis. People as well as animals, like our pets, are vulnerable to this disease. They can be infected if they are exposed to the urine of infected or carrier animals. These animals can be our pets or pests like rats. They can also get infected from water, soil, or food contaminated with infected animal urine. Leptospirosis bacteria can enter the body through skin or mucous membranes such as our eyes, nose, or mouth. The Department of Health of the Philippines or DOH reported an increase in leptospirosis cases this year compared to the previous year. The number of cases reported August 2022 increased by about 27% from 828 to 1,178 of the same period. 156 died. The clinical presentation of leptospirosis varies from mild to severe, life-threatening and fatal outcomes. Leptospirosis symptoms include fever, chills, headaches, muscle aches, vomiting, stomach pain, diarrhea, red eyes, skin rash and jaundice, which is the yellowish discolorations of the eyes and skin. Without treatment, leptospirosis can lead to kidney damage, meningitis, or inflammation of the membrane around the brain and spinal cord, liver failure, respiratory distress, and even death. The most severe form of leptospirosis is Weil's disease, seen in 5 to 15% of infected cases and typically involves multiple organs damages accompanied with jaundice, acute renal failure and hemorrhage, and has fatality rate of more than 10%. To establish the diagnosis, which mainly clinical and history of waiting, the most common way to diagnose leptospirosis is through serologic tests. There are two types, either of the two suffice. One is the microscopic agglutination test or MAT, and the other is a solid phase assay for the detection of immunoglobulin M or IgM antibodies. Most cases of leptospirosis are self-limited in the absence of antibiotic therapy. But, as some patients develop complications with significant morbidity and mortality, it is advised to take prophylaxis upon exposures. Please approach your friendly doctors in your community, they will be happy to help you. Mild diseases favors treatment with antibiotics such as doxycycline or azithromycin. And for severe diseases who are hospitalized, favors treatment with intravenous antibiotics aside from the supportive management. This may last usually for 7 days. Critical illness with severe organ damage may require mechanical ventilation, plasmapheresis and/or hemodialysis, whichever support is needed by the patient. Again, in case of symptoms with history waiting, it is advised to visit your community doctor. This is to prevent progression of illness to critical form. Late recognition and intervention might lead to significant morbidity or worse, mortality. The most important control measures for preventing human leptospirosis include avoiding potential sources of infection such waiting in flood water, animal farm water runoff, rodent control, and protection of food from animal contamination. Antimicrobial prophylaxis for high-risk individuals may be helpful. Vaccination of domestic animals against leptospirosis can provide variable levels of protection. Thank you for watching this topic. If you like this video, please don't forget to like and subscribe. And hit that notification bell so you won't miss the next episodes. You may write your comments down as to tell us what topics you would like me to discuss. Don't forget to watch the previous vlogs, I'll write the links below. See you on the next interesting topics only here when the doctor is out.